podcast, or storytelling. And the rise of Neuralink net, a long technology's introduction, the age of intelligent connections. In the early years of the 21st century, the world stood on the edge of technological transformation. Smartphones had reshaped communication, artificial intelligence was expanding rapidly, and robotics had begun to walk among humans. But one dream remained out of reach, the dream of connecting the human mind directly to intelligent machines. Not with keyboards, not with screens, not even with voice, but with pure thought. That dream became real with Neuralink net, the technology that changed human life forever. This is the story of how it was imagined, invented, engineered, challenged, and eventually became part of Chapter 1, the founders. Neuralink net was founded by 3 individuals, each from different backgrounds but united by a single question. Open quote, "What if we could remove the distance between the human mind and information?" Close quote. Dr. Elena Waweru, Kenya, the neuroscientist. Elena grew up fascinated by how memories worked. After losing her father to Alzheimer's, she dedicated her life to understanding neural signals. Her research at the University of Nairobi became the foundation for brain signal decoding. Marcus Felmany, the AI programmer. Marcus was a quiet genius who built an AI language engine at the age of 16. He always said, open quote, "Humans don't need faster devices, they need closer devices." Close quote. His AI architecture became the core intelligence behind Neuralink net. 3. Dr. Aisha Ramirez, Brazil, the bioengineer. Aisha specialized in nanofibers and flexible electronics. She solved the biggest problem. How do you connect electronics safely to the human brain? Her miniature neural fibers became the physical bridge between biology and technology. Together, they formed Neuralink Net Labs in 2032. The first breakthrough. The founders' first success happened by accident. During an experiment, Elena placed a prototype neural reader near a patient's motor cortex. Marcus ran a decoding program, and suddenly a robotic arm across the room moved. Not because someone touched a button, not because someone spoke, but because the patient thought about moving it. For the first time in history, a machine responded to a human thought. News spread quickly, investors rushed in, governments grew interested, and the world prepared for a revolution. Chapter 3. How the technology works. 1. The neural fibers. Aisha's nanofibers were as thin as human hair. They sat gently on the surface of the brain, reading signals without harming tissue. They worked like tiny microphones listening to neural activity. 2. The AI translator Marcus built an AI system that could translate electrical signals into words, commands, and actions. If the brain said, "Open browser," "Move left," "Search weather," "Memorize this page," the AI translated the intention into action instantly. The cloud network. All data traveled through a secure encrypted network called NeuraCloud. This allowed users to access their memories, documents, or digital assistants from anywhere, just by thinking. 4. The wearable interface. Instead of surgery, Neuralink net created a wearable headband used by everyday people. It scanned the surface of the skull and created a temporary neural map that communicated with AI. No needles, no implants, just technology meeting biology safely. Chapter 4. How people benefited. 1. Education. Students no longer needed to memorize everything. They could think. Open quote, "Show me the structure of a cell." Close quote, and a virtual 3D hologram appeared before them. Languages were learned in weeks instead of years. 2. Healthcare. Paralyzed individuals moved robotic limbs using thought. Stroke patients recovered speech faster because the AI reconstructed damaged signals. Blind users accessed AI-generated vision descriptions. Deaf users received real-time captioning inside their thoughts. 3. Work and productivity. Workers no longer searched through files manually. They simply thought, open quote, "Find the report from last week," close quote, and it appeared. Architects designed buildings by imagining shapes. Musicians composed songs directly from ideas. Writers dictated novels at the speed of imagination. 4. Daily life. Opening doors, turning on lights, controlling appliances, all through thought. People with disabilities gained independence and mobility. Communication became faster, more private, and more natural. Chapter 5. The challenge is every breakthrough comes with obstacles. 1. Privacy fears. People asked, open quote, can the AI read all my thoughts? Close quote. The founders created strict rules. Neuralink Net only read intentional commands, not random thoughts. Still, fear remained. 2. Government regulations. Countries demanded oversight. Military leaders wanted to weaponize the tech. The founders refused, insisting it remain a civilian technology. 3. Economic inequality. At first, only the rich could afford the neural headbands. After public protests, the company introduced free community models for developing countries. 4. Psychological effects. Some users became too dependent, forgetting how to type, write, or speak without AI. A new field, neurodigital therapy, was created to help people balance technology and humanity. Chapter 6. Global adoption. By 2040, Neuralink Net became part of daily life worldwide. In Africa, farmers used neural data tools to forecast weather and soil conditions. Medical camps connected rural patients to AI doctors. In Asia, crowded cities used thought-controlled traffic systems. Students accessed shared learning memories. In Europe, factories ran on hybrid human-AI coordination networks. In the Americas, elderly citizens used neural assistants for memory support and daily guidance. The world changed quietly, rapidly, completely. Chapter 7. Real-life stories. Story 1. The boy who spoke again. A 9-year-old boy in Ghana lost his speech after an accident. With Neuralink Net, his brain signals were translated into a digital voice. For the first time in years, he told his mother, open quote, I love you, close quote. Story 2. The blind engineer. A blind engineer in Mexico used AI vision mapping to become one of the world's best drone controllers. His drones inspected bridges by translating video into neural vibrations. Story 3. The elderly musician. An old Ugandan musician named Z Kagoda lost the strength to play violin. Using the thought-to-sound interface, he composed an entire album by imagining the melodies. Chapter 8. The future of Neuralink Net. The founders announced Project Horizon, the next step. Technology that allows two minds to share ideas instantly. Imagine learning from someone's experience, not by reading, not by watching, but by feeling their memory directly. They described a future where doctors transmit skills to trainees, artists share creativity, teachers give lessons through experience, people communicate without misunderstanding. It was not science fiction anymore, it was destiny. Conclusion. The technology that made humanity think differently. Neuralink Net did not replace humanity, it expanded it. It allowed people to learn faster, heal better, work smarter, and live more connected lives. It reminded us that the greatest technology ever invented is not a machine. It is the human brain. It begins to shape daily life. Yet even with all these changes, the human brain, the most powerful computer ever known, still stands alone. It cannot speak directly to machines. It cannot send thoughts across a network. It cannot restore what illness or injury has taken away. Then came a company with a dream that felt like science fiction. Neuralink. Founded in 2016 by Elon Musk, along with a team of neuroscientists, engineers, and robotics experts, Neuralink wanted to build something the world had never seen before. A brain-computer interface, a tiny device placed in the skull that could connect the human mind to technology. This is the story of how that idea began, how it grew through labs and research, how it was tested in animals, how disabled people hoped it could change their lives, and how the future might look when humans and machines finally become connected. Chapter 1. The futuristic vision. Before any research began, Neuralink's idea lived in imagination. Futuristic illustrations filled the screens in their early presentations, human silhouettes with glowing lines running through their skulls, brains surrounded by digital circuits. People controlling computers without moving their hands? At first, these images felt like dreams, but for Neuralink's engineers, they were blueprints. They imagined a world where a person with paralysis could move a robotic arm with just a thought. A blind person could see again through a camera connected to their brain. A stroke survivor could speak again using a brain-linked computer. Healthy people could one day type with their thoughts, store memories, or even communicate mind to mind. It was not just technology, it was a new relationship between humans and machines. The idea scared some people, amazed others, but for those who had lost abilities, it offered hope. Chapter 2. The laboratories of the new brain era. Inside Neuralink's labs, white light shines on chrome tools. Robotic arms sit motionless until activated. Engineers in clean white coats talk quietly as they assemble microscopic threads thinner than a human hair. These threads, the center of the device, are what connect to the brain's neurons. Each thread carries tiny electrodes that listen to electrical signals. Neurons talk in electricity, sending messages that control movement, thoughts, and sensations. If the device can read those signals, it can translate them into commands for machines. The process is unbelievably delicate. Human hands cannot place these threads without damaging the brain tissue. So Neuralink built a surgical robot, a machine that can insert the threads precisely into the brain, avoiding blood vessels and placing each electrode exactly where it needs to be. Scientists spent years testing how the electrodes behave, how the threads bend, how the brain interacts with the device, how to make the implants safe. Their labs were filled with computers tracking thousands of signals at once. They created rooms where engineers tested robotic motion, high-magnification microscopes that displayed the threads, and software systems that translated neuron pulses into data streams. Every day, researchers discovered something new, sometimes exciting, sometimes frustrating, but always pushing forward. Chapter 3. Animal Research, the Testing Ground. Before Neuralink could help humans, it had to be tested in animals. This part of the story is sensitive, but it is also part of scientific history. The researchers worked with pigs, sheep, and monkeys, species that have been historically used in brain research because their neural structures provide good data. In 2020, Neuralink revealed a pig named Gertrude with a working implant. When Gertrude sniffed, walked, or touched something with her snout, her brain signals appeared as glowing lines on a screen. This demonstration proved that the implant could read real-time neural activity. Later, Neuralink showcased a monkey named Pager that used a brain implant to play a video game called Pong without touching the joystick. The monkey simply thought about moving the paddle, and the computer followed the thought. These demonstrations traveled around the world. For some people, they were a sign of incredible future technology. For others, they raised ethical questions about animal welfare. But in the scientific community, they confirmed one thing. The technology works. The mind can speak to a machine. Chapter 4. People waiting for a miracle. For millions of people living with paralysis, blindness, speech disabilities, and neurological diseases, Neuralink represented more than science. It represented a chance to live again. In a rehabilitation center, you might find a man who lost movement after a car accident. Years of therapy helped him adapt but could not restore his hands. He dreams of picking up a cup again. Somewhere else, a woman with ALS who lost the ability to speak communicates slowly through eye tracking. She imagines a world where thoughts flow directly into speech. Parents of a child born paralyzed imagine a future where their child moves a wheelchair through thoughts alone. These stories brought emotion into the labs. Scientists who worked long hours with data and machines listened to patients explaining what the technology could mean for them. It gave the work purpose. Chapter 5. The first human implant. After years of testing, revising, and redesigning, the day arrived. Neuralink received regulatory approval to begin its first human trials. A young man named Noland Arbor, paralyzed from the shoulders down after a diving accident, became the first known human to receive the implant. The surgery took place using Neuralink's robot. After recovery, Noland sat in front of a computer. Electrodes connected to neurons in his brain picked up signals when he imagined moving his hands. Slowly, the cursor on the computer screen moved. For the first time since his accident, Noland could control a computer using only his mind. He played video games. He moved pages. He browsed the internet. His smile lit the room. It wasn't science fiction anymore. It was happening. Chapter 6. The Road of Challenges. Even with early success, Neuralink faced challenges. Making the implant wireless and long-lasting, avoiding infections, ensuring the threads survive inside the brain, keeping the device secure from hacking, managing public fears about mind reading, answering ethical questions about AI and the human mind. Each challenge required new science, new tools, and deeper understanding. Some scientists believed brain implants are the next step of evolution. Others warned of dangers in merging technology with human identity, but Neuralink continued. The future of human and machine, imagine the future Neuralink dreams of. 1. Disabled people walk again using robotic exoskeletons controlled by thought. The implant reads brain signals for movement and transmits them to robotic legs. 2. People who cannot speak talk using thought-to-text systems. Their brain activity forms words on a screen. 3. Blind people see using a camera linked directly to their visual cortex. And 4. People store memories externally or replay old ones. 5. Humans communicate silently brain to brain. 6. Education changes. People upload knowledge instantly. 7. AI becomes an extension of the human mind. This is the world Neuralink imagines, a world where human limitations are not the end of a life, but the beginning of new possibilities. Final chapter, the neural bridge. The story of Neuralink is not finished. It is still being written in laboratories, in hospital rooms, in rehabilitation centers, and in the imaginations of people dreaming of a better future. It began with futuristic ideas, passed through years of scientific testing, touched the lives of disabled people, traveled through careful and controversial animal research, and arrived finally